To more stories, radiology experts are concerned about resource limits and insufficient radiology skills and services in Africa, particularly for cancer detection and treatment. Now, as the continent grapples with the rising burden of cancer, the intersection of oncology and radiology emerges as a complex landscape where cutting-edge advancements contend with pressing issues of accessibility, affordability, and healthcare system economics. Now, in October, Cape Town will host the continent's premier medical and healthcare gathering, the Africa Health Congress, at a 3-day conference. The event is formatted around dynamic sessions that encourage knowledge exchange and actionable insight. Now, field-leading experts from around the continent will engage on topics like screening and diagnosis for breast, prostate, and other forms of cancer, and unpack advancements in emerging tech like CT scans, MRI, and AI-powered diagnostics. The Africa Health Congress aims to address these challenges and explore new opportunities. Joining us live to discuss this is radiologist Dr. Tamiya Nair. She joins us from Cape Town, South Africa. Thank you so much, Dr. Nair, for joining us.
Thank you so much for having me.
My pleasure. Now, Dr. Nair, what is the current state of radiology facilities across the different African nations, not just South Africa now, and how do these resources and the disparities in the availability of them affect the access to radiology services in the urban versus the rural areas?
So unfortunately, like a lot of things in the world, radiology and oncology is very linked to geopolitical and socioeconomic resources. And there are great divides between the East and the West, high income versus low income areas, first world versus third world, rural versus urban, and private versus public. This is often a result of the distribution of resources. The most important one for us is the human resources, and radiologists as well as oncologists are specialists in imaging and cancer treatment specifically, and these are very scarce resources. There often aren't very many training programs in Africa that allow us to build enough capacity to train specialists. And when we get this right, there's often a brain drain. So we often find that specialists leaving Africa and heading over to North America, Europe, for better opportunities. So that adds an additional pressure. So there are great disparities. Other disparities that occur because of these is the quality of care that patients have access to. There's often a shortage of trained personnel. In radiology, there's a shortage of advanced equipment. The equipment is very expensive often and requires updating of software and hardware quite regularly, so that it becomes an expensive speciality. And often in Africa, we don't have this funding. So you often find that the distribution of equipment and human resources tends to focus in urban areas amidst the private sector because of these reasons.
All right. Also, Dr. Nair, what strategies would you say can be employed to raise awareness about the importance of radiology services in healthcare delivery?
So one of the things I'm passionate about is screening. So this month is prostate screening awareness, and it's the month of September, and next month is the breast awareness campaigns of awareness of breast cancer. It is so imperative, and it's a cheap and very grassroots strategy to increase awareness. So we create these months around educating the public on what options are available. So for example, breast cancer awareness, have you had your mammogram? So that's one of the strategies. Another strategy is media campaigns. So it's very important, and thank you for this opportunity at creating awareness, to get the word out there and to debunk the myth that radiology is dangerous. And because they're X-rays and radiation, we have advanced equipment, and with every iteration of this equipment, it becomes safer and safer with lower doses of of radiation. Not all the equipment has ionizing radiation, and it's usually balanced with the knowledge of the condition that we're looking for. So we use it very safely. So it's important to address this misconception. It's also important to realize how important radiology is in the journey of a patient, and specifically in the journey of a cancer patient, from screening to diagnosis. Diagnosis being you come with a symptom and we find what causes the symptom, as well as staging if we do find a cancer. So we look, if we do find a cancer, we diagnose it using image-guided intervention. So we use, for example, for breast cancer, we will guide the needle into the breast mass and get the diagnosis, as well as staging of the cancer to see where it's spread in the body, and treatment options of the cancer. So in these cases, treatments like cryoablation, radiofrequency ablation, these are interventive strategies which we can use to actually treat cancers as well. So there's a very broad spectrum, and part of the creating awareness is to educate the public, the community, as well as healthcare professionals on what options there are and how we can help.
All right, thank you so much, radiologist Dr. Tamiya Nair, for joining us and talking to us extensively about the importance of these scans. Thank you once again.
Thank you.